Hi, everybody. Today, I believe, is January 23rd, and I just wanted to share with you my latest PET scan results. I have them on my phone here. You can't see it, but anyway, it's on there. So I had my PET scan almost a week ago on Monday, and the little summary area, this is what it says. It says, increased size and metabolic activity in multiple lymph nodes of the chest and upper abdomen and plural left lower lobe nodules. Multiple new hypermetabolic lymph nodes, supraclavicular, left subpectoral, cardiophrenic, and gastrophrenic ligament. That was a new one to me. I have to look that up. And it says findings suggest interval progression of disease. So, so this is basically, I've had 14 or 15 treatments of Herceptin and Perjeta, and I had 4 rounds of chemo at the very beginning of that. And the 4 rounds really did a number on it. So when I had my 3-month scan, the tumors were really quiet. So I'm like, okay, well, the doctor says, let's go ahead and take a break from the last 2. And the next scan after that showed lymph nodes popping up. Oh, well, now my case is a little different from a lot of cancer people's situation, is that I also have an autoimmune disease, which causes inflammation, and it can also cause lymph nodes to pop up out of the blue, unrelated to the cancer. So, and this PET scan is demonstrating a similar thing. More lymph nodes, and I could tell the lymph nodes in this area were starting to get aggravated again, because when that happens, my swallowing gets a little more not challenging at times. So sometimes I'll choke on my own spit. Okay, it's kind of stupid, but it happens. And then I'll get more stiffness, in the neck and shoulder area. But what I did also find, which I found interesting, is that since I thought I was going to have to do chemo again, my doctor wasn't able to get back to me. I think she had a medical emergency she had to take care of, which was fine. It didn't bother me that I didn't do chemo this time, because I had my treatment on Thursday, so I didn't have to do chemo yet. So I took the dexamethasone, which is a pre-chemo anti-inflammatory, and it does other things too. But when I took that, a lot of the pains went away, which told me a lot of the stuff that I have going up here was being aggravated by inflammation. It doesn't mean there was no cancer in there, but I think it was being aggravated by the inflammation. But that's starting to slowly return, because I only took the one pre-dose. Usually it's, 8 milligrams in the morning, 8 milligrams at night the day before. Then you don't take it the day of. Then you take 8 milligrams the day after, then 2 milligrams, and then you're off of the dexamethasone. It's just to help with the chemo side effects. But when the doctor didn't call me back that by the day before chemo would have started, I didn't take the second dose. But that 8 milligrams was enough to really just knock down my pain, and I felt fantastic. So that just kind of reaffirms that I do have inflammation problems. My blood work also confirms that as well. But so as far as the rest of the report goes, it just talks about how some of the lymph nodes are a little bit hotter. They're more active. A couple of them have grown by a couple of millimeters, which is kind of coincides with them being hotter. Let's see. So now the subclavicular lymph nodes, I've had those before. They're basically underneath your clavicle bone here. All right, and I get those. I've gotten them off and on for years. There's one that's 1 centimeter. It's on the left side, so that would be over here somewhere. And I had this one biopsied. Yeah, this one was the one that was biopsied. So the one over here is a little bit larger. It's 1 centimeter. And this one over here is 0.8 centimeters. And so those are new pop-ups. Now, I have been having some head issues and a little bit of chest issues, but nothing serious. I don't think it's solely due to an infection. I think it's something else going on. Now this is the first time I've really seen them talk about this way, but sub-centimeter. So it means maybe millimeters. A left subpectoral lymph node. Now I've had that before. That's close to where I had my first breast removal, and I get a spot there, and it kind of bugs me once in a while. But this time it's pretty warm. It's at the SUV was at 10.6, which is pretty warm. usually a background SUV, which is basically how metabolically active things are, is like between 1 and 2, up to 3 in some areas. But so it tends pretty hot. And then there was a cardiophrenic. I'm not sure exactly where that is, but cardio means heart, so somewhere around the heart. And it has an SUV of 6.2, but it's very small. So it's either new or something is going on. Now in the abdomen pelvis area, liver was good, gallbladder's normal, spleen's normal, pancreas is normal, adrenal glands is normal, kidneys are fine. GI tract is heterogeneous, FDG, which means the uptake was normal. No lesions in there. The lymph node areas in there were some small lymph nodes, hyperbolic, retrocrural, and left para-aortic lymph nodes are larger and more metabolically active. New FDG avid sub-centimeter lymph nodes in the gastrophoretic ligament. So that one was interesting to me. The gastrophoretic ligament. So basically, it's a part of your intestines are held in place by different ligaments and such, keep them from getting all tangled up. So between the stomach and the liver, they're connected through these little ligaments. So gastrohepatic. I don't know what I was saying before, but gastro, stomach, hepatic is liver. So there's basically these little ligaments kind of hold these guys close together. And on those ligaments, there's some lymph nodes, and they're getting active. Now, I was concerned that maybe those lymph nodes could indicate cancers going into those areas. I don't know. It also could mean I did have some kind of intestinal issue where my poo was a color of green smoothie, and that is not normal for me under any circumstances, even through chemo. So I think I definitely had something going on intestinally, and it resolved within 2 to 3 days. So I'm hoping that gastrophoretic ligament hyperbolic activity was just as a result of that. I don't know, because I really don't want to have tumors in my liver again. I had that, back in 2016, and I didn't feel anything, but when it gets in the liver, it's not, you don't want that. But they were small. But everything else was pretty good. Now, I have 3 little bone ones that they're talking about, and they're in their hip area, the iliac bone. So I have one in my L4, that's the lumbar area, the lower part of the back. It's slightly warm, but they don't talk about size. It just says it's slightly more active. It used to be 2.7, now it's a 4.1. So, I don't know that that's been there. It hasn't been doing too much over the last year, I guess. The right sacrum, that's that big bone, like by your tailbone. You can think about like the top part of the tailbone, but it's not the tailbone. Okay, it's just that area of your body. It's actually quieter this time. It was 2.4, now it's 2.0, so it's less active than it was. So go figure. Now the left iliac bone near the SI joint. So that's basically where the part of your hip bone or your iliac bone connects to the sacrum bone. The sacrum joint, I believe it's called. Don't quote me on that. But so its max uptake was 5.8. It was previously 2.4. So that's the whole of the report, basically. Basically, lymph nodes and the couple of ones in my lower back. So that's not bad. I mean, with my autoimmune, my mixed connective tissue disease, it's really hard to tell for sure what's going on. But when it moves into the bones or some other organ, then I go, oh, it's definitely cancer at that point, because there's certain telltale signs. When it's in the bone, you start eating the bone away, that's definitely cancer. I haven't seen any research that would indicate that would be autoimmune that would do that. But when it's in the lymph nodes, there's definitely questions as to exactly what's going on. The only way to find out is to do biopsies. I don't want to keep biopsying my lymph nodes because that could cause lymphedema and other complications. But we did that last one there because things really got hot really fast a lot of places. And my bones, there was a lot in my bones. Like, well, we better make sure that the cancer type didn't change. And in fact, it did change. I was lucky in the fact, I guess you can call it lucky if we have cancer. It's not really, nothing's really lucky, but I gained a marker. So usually when you're undergoing cancer treatment, you lose markers. So there's markers such as HER positive, estrogen, and progesterone positive. And so, I started out as HER negative and estrogen, progesterone positive. So we treated that, and that worked for about 3 years. then everything kind of lit up again like a Christmas tree. I had over 30 tumors again. So it was like, boy, a lot of them were lymph nodes, but I had a lot in the bones too. Luckily, we got them before they did any damage. No broken bones this time, which was awesome. Like back in 2016, I had a few fractured ribs, and that was very uncomfortable. But nothing broken in the spine, which is fantastic. Just close calls. But I left my train of thought. But you know, the bones tell me a lot. So when the bones get affected, I know it's the cancer resurging. But when it's just lymph nodes, I have to think, do I really want to change my treatment? Now, because I say that because I think I've talked about this before, back in 2017 when I was still in Ibrance. It's only been like a year and a half. I had a chain of lymph nodes light up, but nothing else. I said, hey, doc, can we just please wait for another 2-3 months and rescan? 2-3 months later, they were all gone. I would have lost a year and a half on Ibrance if I had allowed the doctor to switch me without waiting and being patient. And that's a year and a half is a lot when you're a stage 4 cancer patient. You don't want to lose a year and a half. That's a long time to lose. So excuse me. Oh, there's my kitty. So, you know, if you're stage 4, you don't want to play this like a sprint. You want to play this like it's a marathon. You want to drag it out for as long as possible. You know, I mean, if it's just a lymph node, okay, you know, it's iffy, depends on where it is. But you have to know your situation. Everybody, even if it's stage 4, even if you have the exact same cancer as me, same tumors, our physiological makeup, you know, my other conditions that are going on are going to affect my cancer differently than it's going to affect yours. So what does something for me may not work exactly the same for you. But so you have to really know your body. You need to really understand how your body works, what pisses it off, what makes it feel good, and, you know, and keep that in mind as you're going through your treatment, and then learn how to read your scans. And when I get my scan, I will be uploading a video of that. But everybody's cancer, even if it's exact same oncotype or whatever you want to call it, our bodies are all a little different. And so treatments won't always work for us the same way. And a progression won't always be the same way. But anyway, so you gotta take it at your own pace, but understand that stage 4 cancer you don't want it to be a sprint. You want to drag it out for as long as possible, because if you burn through all of your different treatments because, oh, I've got a new lymph node, I could be dead already. Okay, so you got to be careful on how quickly you change your medications. Hey, if you go to a scan and you've got liver metastases or bone, there's no question you've got to do something about that. But if it's just a lymph node or a couple of lymph nodes and you're already stage 4, well, let's see if maybe drag it out a little bit. Maybe give it 3 more months this time. Okay, now there's 4 lymph nodes. Okay, nothing in the bones or liver yet? Well, maybe you can drag it out another 3 months. That's 6 months that you're able to kind of drag it out. And that the next therapy works, all those lymph nodes will go back to sleep. They'll just boop. And then you would have gained 6 months that you wouldn't have had otherwise. Because if you start your new treatment, that 6 months ago, and that new treatment, and it starts to fail after 6 months, bam, you know, you're on to another treatment already. So just, you know, it's a chance. It's kind of like almost like gambling. And, you know, if you think your hand is bad, you're going to fold, and then the game's over. So, but you know, if you're willing to take that gamble, that says, hey, maybe my hand will be better than that guy's hand. You know, you might win. You know, you might win some time. So don't be in a rush to go through your therapies. I mean, give it a chance. Do a lot of research. I thought about doing some more videos on researching, because I think a lot of people have difficulty in how to research it. And I think really it's about finding the right words. If you have a question, like today I was researching because of I get blood work done every 2 weeks because of my treatments. My lymphocytes, which is part of your white blood cells, and my neutrophils, which is also part of white blood cells, they're out of whack. I have too many neutrophils and too few leukocytes. And so when that happens, it causes an inflammation set up, and it's, of course, a lot of us know that inflammation is bad for cancer. And I'm trying to figure out how I can mitigate that so it's not so bad. And I noticed that certain medications seemed to aggravate that situation, and it wasn't what you thought. It was actually prednisone, which is an anti-inflammatory. It drove up my neutrophils, my neutrophil auto count, and it drove down my leukocyte auto count, which puts, when you do the ratio on it. Now, this I could have this wrong, but there's a ratio between neutrophils and lymphocytes that kind of, they're finding that there is evidence that can kind of give you a prognosis for treatment. And while I was on Abrams, the ratio was nice. It was a good ratio. It had a good ratio between the neutrophils and the lymphocytes. But when I was still on Abrams and they put me on the prednisone for my autoimmune, the ratio went, it spread apart, where one went down and one went up, and it was not in the right direction. And it doubled the ratio, which was bad. So we're trying to figure out, this is why that happened and how I can mitigate the effects, because a lot of us, like I said, know that inflammation is bad for cancer. And, I know that people say, oh, gluten's bad, it's inflammatory and blah, 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 blah. But, it's in everything. And I there's a lot of foods I can't eat because it really irritates my stomach now because of all the medication I'm on. Speaking of which, my stomach's making noise right now. But anyway, so as I learn more about that, I'll be making videos about that, because I think it might help some people, not everybody, but it'll help some. But for those of you who are doing H&P, I don't know if you've had this thing where after your treatment you get like, it feels like your stomach is like really, really big, and it just feels like it's pushing pressure on your chest. And I haven't quite figured out what's going on, if that's inflammation related or not. I'm going to do some research, ask my doctors, and see if they know, and if there's any way to counteract it, because it lasts for 2-3 days, and it's so uncomfortable. But it does only last for 2-3 days, and after that, then the diarrhea starts, which is like, okay, well, at least now I don't have so much pain, but I feel like my ass is on fire. So, but overall, I'm doing okay. I was taking vitamin B's, and so my research indicates that vitamin B's might actually be making my white blood count cell more aggravated. So I'm going to, sadly enough, not take that for this next 3 weeks and see if it changes my my counts in a way that would make it beneficial, because I did start taking more of that when I was having problems with energy, and that was right around the time I started chemo. But it's one of those things where a lot of people say that supplements don't really bless you, kitty, that don't affect things. So it'll be interesting to see if it does or does not. But so if you're having a similar situation with your white blood cell counts being kind of wonky, vitamin C is supposed to be an immune modulator, so look into that. B vitamins are supposed to help build up neutrophils, so if you have a low neutrophil count, vitamin B's are reported to be helpful with that. Doesn't mean it's going to cure, but maybe it'll help. It certainly gives you more energy. It helped me with my energy. Sorry, I noticed that. But also zinc, which is good for your immune system, helps fight off virus and such. And vitamin D, it has a lot of different uses, but it's also a strong anti-inflammatory. And a lot of people who have inflammation are very deficient in vitamin D. So I take 5,000 milligrams a day, and I might up that a little bit just to see if that helps with the inflammation that I do already have. I know that I have it. It's my blood work, so I know I have it. But anyway, so when I get that DVD, I will be sharing that and kind of, talking about, my decisions, and maybe it'll help you in your decision making, one way or the other. But as always, as I keep saying, find what you love to do it, and share it with others, because we only have so much time to do it, and no matter who you are, no matter what your health is, none of us know when our time is going to come. So enjoy this time. Try not to get hung up in all the politics is going, because things are going to work out the way they're going to work out. And we don't have all the facts. So don't sit there and worry about it. Just do the right thing, follow your moral conscience, and enjoy life, because no one knows when it's going to be over for anybody. All right, guys, take care of yourselves. Bye-bye.